Hey guys. Okay, so this is for discussion 13, the one about the airway management. So, upon reading the articles, now I've read several of the ones recently that ask whether or not paramedics should be able to intubate. And I've read a few that ask whether or not they should teach EMTs to intubate. So, my opinion is that yes, paramedics should be intubating in the field. Do I think that sometimes RSI is done when not necessary? Yes. I do think that sometimes it's a quick go-to method that paramedics reach for when less invasive methods could have been attempted first and potentially successful. However, I do feel that it is important that paramedics are able to intubate in the field because sometimes people work in rural areas and you have a transport time of 30 minutes or more, and you're going to have a patient that's so critical that they need to be intubated. But there are times when attempts at that are unsuccessful and we end up damaging the airway due to numerous attempts. Do I feel like it is a skill that we don't use as often and so we can become complacent or rusty in it? Absolutely. Would it be beneficial to have more frequent training on it? Absolutely. Now, I read a study, and it's a little bit older, but I still think it holds true, and it's from the Annals of Surgery journals online, which is, I was trying to find the website name. I mean, that's what it's called, but it's journals.lww.com, Annals of Surgery. And so they did pre-hospital rapid sequence intubation improves functional outcome for patients with severe traumatic brain injury. Now, and that's just one of the ones that I found, but their deal stated that a total of 312 patients with a traumatic brain injury were randomly assigned to paramedic rapid sequence intubation or hospital intubation. Now, the success rate for paramedic intubation was 97%. Now, it doesn't say if that was first pass success or third pass success. Okay. But what it does say is that at 6 months, the median, it says GOS score, was 5 in patients intubated by paramedics compared to the 3 GOS score in patients intubated at the hospital. So the proportion of patients with favorable outcomes was 80 out of 157 patients in the paramedic intubation group, where it was 56 out of 142 patients in the hospital intubation group. So there are times when being able to establish that airway pre-hospital is imperative to a good patient outcome, to where they have the ability to be able to recover and live a meaningful life, not on the vent for the rest of their life, not brain dead because they went too long without oxygen. There are times when people are intubated in the field when it could have been done in hospital. So I do agree with that, but my biggest thing is that I do believe that paramedics should be authorized to perform intubation pre-hospital, and I don't think it should change. I think we could offer more training, refresher courses more frequently, but I absolutely think it's necessary to have that capability. All right, see you guys next time.